Hello, everyone. I'm here with Valeriya Dragneva, a provider of emotional care, and we would like to spend some time talking about the topic mourning and grief. We are thinking to make these somewhat regular on different topics so that you can listen in and get hopefully some interesting insights. So thank you, Valeriya, for taking the time and being here.
Thank you for this opportunity, Matthias.
Mourning or grief is certainly, not an easy topic to start with. It's by definition emotionally heavy. I might be able to share some perspectives and insights how to work with it, when to work with it. I have some thoughts about that, of course, and we will just see where and how the conversation takes us. I do have a quote, however, that I found. It's a movie quote from this movie, The Geisha. It's a Hollywood movie, and I think it's even a book. And there is this quote which goes, "At the temple, there's a poem called Loss carved into the stone. It has 3 words, but the poet has scratched them out. You cannot read loss, you can only feel it." From this movie, Memoirs of a Geisha by Arthur Golden, I should say that correctly. That has stuck with me over all the years and I think it encapsulates somewhat in essence, and maybe it's a nice starting point, that however we try to talk about the feelings associated with loss, it is so intrinsically human, so fundamental, that talking about it never really changes it so much. It is, maybe this is also the very first point I'm making before I hand over to you, is to say it's a universal thing that humans go through, and is something one in a way needs to go through in the one or the other way. And we will also probably discuss in what situations people might need help with that, when not. And so I thought this is maybe a nice starting point for a serious topic, obviously.
Yes. If I may suggest one point that I was reflecting on lately, and that was about human beings actually coming at this world, the world prepared to have lost something. And I think that this is kind of inevitable, and it is very much related to the fact that we're coming also at this world to get attached to something. So do you think that loss is therefore related to attachment?
Yes. I mean, one could maybe even say it's the price of attachment and connection, in a way, right? In emotional work, and you know that, if we are activating emotional resources, and for example, a grandparent, right, who is the positive, evoking positive emotions, thinking of that grandparent in this example. And then typically, we usually ask, is this grandparent still alive?
Yeah.
And sometimes they're not, naturally. And then comes in a sadness, that feeling of loss, mixed with a melancholy that these moments aren't happening anymore, like these feelings somewhat mix. And the greater and the deeper the feeling of loss, the more intense the relationship has been.
Yes, exactly. And what about what is, there are a lot of myths about what are the stages of grieving and what a human goes through once they lost or somebody who is very close to them. so therefore related to death of a close person, or related to loss of a connection that was very important for them, like for example friends, but actually not having the connection with this friend anymore, or not having anymore this job that they were content with or happy with.
I think you
Are
point out very rightly the. I'm already picking up because there may be even two things in there. Um, we spoke about loss recently, right? Which kind of led us to be here. And I think a very important realization is that there are certain, like the examples you mentioned, loss of a job, loss of a friend, which are also associated with loss and the associated mourning process about it, which might not be obvious to everyone. No? Like if a loved one dies, it's pretty obvious to everyone that this is loss, mourning, and grief, right? But when it comes to a friendship, that might be a new realization for some people that this is also a grief process.
yes,
And that then explains why it happens the way it happens, which is it takes a long time, it comes in waves emotionally. Everything that applies to grief and mourning in the other typical examples can also apply there. So this is one comment, and the other thing you raised about the stages of grief, but do let me know if you want to go there right now.
yeah, I would like to elaborate. I heard you saying coming in waves. This was related to the process of grief.
Yeah, I mean, in many societies, when a loved one dies, a close family member, then you get these few days off work, right?
Uh-huh.
I mean, you live in Bulgaria. I don't know if you have that in Germany, for example, where I'm from. I think it's a couple of days. I'm not even sure about it, and I think employers are, let's say, patient with you for like 2 weeks. Or I think it's even a week or 2 weeks that you get off exceptionally from work. And then there seems to be always this kind of clock in how long it's supposed to take and when you have to be functioning and fine again, right? Which is, of course, not how it works,
No.
right? I mean, in my experiences, grief can take a very variable amount of time to really impact on someone. And I would say grief actually never ends. When it was meaningful, when it was deep, right?
Yes.
It never ends. We just learn how to live with it.
Can that be related with the fact that the connections continues to live under the surface of our consciousness? Or I can also give the question in another way to reflect on: is it good for a person who is going through a grieving process to keep on actually having this connection with the person that they have lost? And does this matter if we're talking about death or another kind of loss, or a pet or a friendship, as I mentioned earlier?
Yes, yes. Fundamentally, emotionally, I don't see so much difference between the examples. That I would like to maybe say as a premise. These examples are certainly different in certain ways, but when it comes to the emotional mechanisms underlying them, they're pretty
Mhm.
much similar, which
Mhm.
is maybe a quite fundamental insight about emotional work in general, in my opinion, that it's not so much about the details, like who was that in your case. The underlying mechanisms are very, very similar. And that makes the working then easier because the strategy to work with grief in one person are very similar usually to working with a different kind of grief. It doesn't really matter what precisely happened. It's really that. But there was something else you were asking that I kind of lost.
Well, it was related to a question I gave about the connection that may continue living under the surface of our consciousness.
Yes.
Is that a, how to say, practice, or is that naturally happening for a human who is
Yes.
currently in a process of grieving or mourning?
Let me see if I understand the question. One thing is that I usually try, or at least I usually don't explain much emotions and the why. Why are they happening, and what are maybe the reasons why there is a certain emotion. They're there, they're coming, and then it's about experiencing them,
Yes.
dealing with them, hopefully constructively, and going through them. So when you're asking, is it good to kind of maintain aspects of that relationship? I would say definitely yes, clearly yes. I mean, grief can be so painful that can block the access to certain aspects of the relationship. But
Yes.
if we look at like mourning traditions, like for example, when there is a burial, and then in some societies people tell each other stories about lovely moments they had with the
Yeah.
person who passed away, like, and they stand in a circle, sit, and they're sharing happy memories and why they felt, why they're grateful to have had this person while they were alive in their life. And this is a way to keep the memory going. And so there is obviously this mix of this extreme pain in many cases, but then this melancholy. I think it would be unconstructive to lose the access to the positive things because we do not want to look at the pain. And I think that would.
That is avoidance, and that also means, the longer you restrain from the process and let it happen, the longer it takes actually for you
Yeah,
to heal, isn't it?
definitely. It takes longer. And then here we have to kind of establish that it's inevitable, right? If it happens now or later, there is the concept of unprocessed grief, meaning you haven't mourned, right? And maybe, I mean, the terminology is sometimes confusing. Just before our call, I was looking it up myself because I'm not so much on insisting on terminology all the time. But in the English language, grief is the emotion that is being experienced,
Yeah.
and the mourning, the external manifestation of it. So any rituals, any things you do to express that. So, I mean, I use the words sometimes interchangeably, but it makes sense in the English language to have these two things. So, I think it's a very important point to establish that if you delay going through the emotion, even if you maybe mourn outwards and whatever your traditions are, you wear black for a year or whatever it is, the emotional process, if that doesn't happen, well, in my experience, like what would be the consequence? In my experience, is it blocks exactly what you're saying. It blocks the access to the beautiful side of that relationship.
Yes.
Yeah, it blocks that. And one could say, well, then, okay, I don't have that. I accept this. And maybe here comes in the question, what kind of grief are we actually considering needs or could benefit from assistance, right? I wouldn't say that applies in all situations, but in certain situations.
Yeah, that's an interesting point. I wanted to point out or emphasize on something that you mentioned earlier, and that was related to traditions in different countries and even legislation related to employees who have just lost someone, and the fact that they're actually pushed in a way to go through the process as fast as possible and come back to the ordinary life, which is not ordinary anymore, because because a person going through grief have to reorganize their everyday life. They have to be able to grieve, but at the same time, they have to think about how to move on, how to do this. I haven't done this before on myself. I was depending on that person that is not here anymore. And this is, I would say, devastating in a way that you at the same time have to comply with the external environment while you're feeling not doing it at all.
Yes, absolutely. Absolutely. I mean, of course, couldn't agree more. I mean, I can only assume that this is the typical desire of society to keep people functioning, being useful as much as possible, right?
Well, I can give an example about Bulgarian legislation. A client that I was having actually had only one day at her to make use of in order to make arrangements for that mother and be able to bury her and organize everything around it and come back to work.
I mean, that's not even enough to even do the organizational aspects of it, let alone the emotional process. No?
So you can imagine the pressure over a human at this moment of life, and yeah,
Absolutely.
what would be the support on me? I mean, how much support you can provide to in this short time frame in order to prepare the person for the next day.
Yes. I think we can agree that the external conditions, the way they are set up, are far from ideal. I mean, there comes the word inhuman to mind. Like, what do we mean when we say, in general, something is inhuman? In my understanding, it means something that is set up in a way that it does not take into account human nature, right? Like normal human needs, and that is inhuman. It's not only very severe crimes against humanity which are inhuman. Also, these kind of structures are in a way inhuman. They don't take into account, and I mean the logic behind it will not add up because I mean there are so many examples where, when it also comes to stress management in certain professions, where we know now, and there's so much evidence that when people are not being pushed to their limit, they are more productive in the end. So if you give someone the time they need to recover, they'll be better employees afterwards. Of course, then you have to have an interest mid or long term in the person. If you consider people exchangeable and replaceable, and you just can, well, if the person doesn't function anymore, we just switch them. If that is what the system is doing, then yeah, of course, they can do that. I mean, when we say unprocessed, I would even say, I mean, if we think about it literal, right? Meaning the part of the grief process that we have still in front of us, the unprocessed.
Yes.
I mean, I introduced the term earlier, so I'm responsible for it. I'm now thinking, is it such a good term? Because, I mean, we all have some grief still in front of us to go through, right? Like we earlier established, it's never really over. So that would mean there's always some grief in front of us. I think the problems arise when we delay going through grief
Yeah.
for too long, and there is no hard cutoff for that. And that circles back to the other point of what are actually the consequences of delaying processing or not processing grief, is you lose emotional access to the good things in that relationship.
Yeah.
Because you can't think of it, it's too painful. Right? It's
Yes.
someone saying, oh, I cannot think of my lovely, lovely grandmother because it hurts me so much. Like, to
Yes.
just make that very clear. And what are the consequences of that? Well, it does impact us. There is an important emotional resource that we lose and we don't have. And people typically cannot compare this. Like, the normal person doesn't know how they would feel or be if they had the emotional resource, because they're just living their life and that's normal for them. But once you do, for example, resource work, and you activate the resource and you help someone doing that grief work that's then necessary to access the resource, you usually uncover and access very important emotional resources which change everything down the road. So you're losing access to something where you don't even know what you have lost, really, because you don't have access to it. It's just not there anymore. And I think that can be interesting for people to be aware of that. You have these resources, and if you don't go through the grief, it's like the treatment you have received, the love, the care, the being accepted the way you are, these very fundamental emotions, they are kind of hidden behind this wall of grief. And if you cannot go through the grief, because if you could, you would,
Yes.
right? You don't have access to it. And you might have other emotional resources. If you're lucky, you have multiple, and there were many people good in your life. But if it's an important key person, that's that. Then you lose access to something that is fundamentally important. And that happens routinely in resource work. It's usually the situation with the grandparents, sometimes with parents, where it's grief that has been put off. And it's not like a decision. I mean, people don't say, oh, let me not go through the grief today. It's just because it's too much. It's too painful. And like we established earlier, when people are busy with organizational things and then life keeps happening and requires their attention, then that. And the other aspect was when we said in waves, and then I'll stop and let you share what you think about what I say, that grief comes in waves is the natural state of things. That is not a sign of anything being like unprocessed. And as I said, the word unprocessed is not implying there's an issue, because we all have unprocessed grief in front of us because it's a lifelong journey. But it's more when we take too long pauses because it's too painful to go through it. And but it coming in waves. And sometimes people are surprised, but it's totally normal that you feel fine for weeks and then it hits you again, And sometimes the environment of people then loses their patience, like, we have listened to that for a few weeks, and then months later, when somebody then really has to sit down and sob and express the pain, sometimes people are not so understanding. They're like, man, it has already been this and that many months. Shouldn't it be over? And here I would like to set the record straight. No, 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 no. That can be a decade later. That can be 20 years later. It will become less frequent, for sure, right? Usually. It will maybe be less intense, maybe not. Usually the frequency, the gaps become longer, but it can still hit you.
Yeah, I would like to touch on this. So it seems that we're again coming back to the pressure from the society, from our community that we're part of during this process. But and also reflecting on the waves and the grief coming into those. Isn't it actually a good practice, a mental oscillation, this I will use this terminology. Therefore, a person who is going through a grief process is exposing themselves consciously to the memories which are related to the person they're grieving or mourning about, and then making the effort to establish good emotions, even though they're bringing back in not so positive memories, and then switch back to everyday life. Like, okay, I have to go to the shop and make this and this and this purchases.
Yes, very good point. The fundamental nature of grief and loss is pain. It just hurts. And this is something when I, for example, I take a little detour when, like in the medical academy I'm running, there is always the conversation when you have visceral pain, like you have pain in your belly, to describe the quality of it. It's a typical question that doctors should ask their patients. Is it pinching or is it like more, generalized pain? Because that can help physicians decide what is the probable cause. And there are important distinctions.
Yeah.
But that pain, that emotional pain, it just hurts. And that means our capacity to go through it is limited. And the rule here is the duration of experiencing that massive pain, this 8, 9, 10 intensity pain, is limited. It is painful, like it's devastating. It takes energy, it breaks you down. There's so many words that we use to describe the physical and emotional effects of that kind of pain. And this pain manifests physically as well in symptoms and literally through our nervous system in our body, obviously. So the key point I'm trying to make is when we advocate to go through grief, there is still a limit to what a person can handle in a moment. And the secret is not just to say, hey, you got to go through this now, but to also limit the intensity and the duration, both. A 10 pain, you want to interrupt that sometimes, right? And that doesn't mean to say, oh no, put that off until next year. No. It's just a pause, like if you accompany someone who is in a 10 intensity loss and pain, the secret is being able to just be there and do nothing, which is also, when you're an empathetic person, difficult. Because you get something, you get some of the pain, right? It hurts you too, especially if you care about the person. And as providers of care, we selectively care about people for limited periods of time, because sometimes we have to disconnect for, not to merge and get too much of the pain. And then we have to process the pain. So it's about being there, but then giving opportunities to take breaks from it. Yeah. Helping them taking a breath, doing something else, and not to interrupt. It's part of healthy grief to not be overwhelmed by it. Because if you're constantly overwhelmed, the body might tell the mourner to, it's too much, I can't do this, I don't want this anymore, I have to totally distract myself because it's just overwhelming. And then the process is being delayed, right? So it's the art of intensity again. A certain intensity, and it's sometimes amazing what people can bear. It's humbling, but still there are limits. And as providers of emotional care, we should allow them to grieve and mourn and experience the 10. Unfortunately, it's often part of life, but then techniques to interrupt it so that it is somehow still manageable. Does that make sense?
Yes. You said overwhelming. So we all understand it as grieving process requires a lot of energy. And we should be able, as a providers of emotional care, to really feel when is this boundary, where is this border of the person that they can not cross over, because then they will collapse and maybe they would need other kind of care from this moment on. And that would mean for me that also it's physically tiring, not just mentally, emotionally,
Okay.
on the pure physical level. And then literally breaks would need to be taken from the person going through this process. But at the same time, being in your body can, in my opinion, support also to switch between regulating your emotions and actually making some physically and literally exercises where you are aware of your body parts, how they function at this very moment, that this can also support the process of grieving going. What do you think about this?
It's a great point, and it's done too little. I hear that from very senior therapists. They say the body work, we don't do it enough. It's coming, and sometimes in clumsy ways, sometimes in smart ways. Who am I to judge? But the aspect that physical stimulation or activity does change our state, I mean, that is established and obvious, and it's being not used enough. And actually, you saying that right now makes so much sense, to say, or to look for these ideas when accompanying someone in grief. What could we do? I mean, there is the let's have a walk.
Yes.
Like, it's an idea I would have, to say, after you sat there for a while with someone, and at some point people also say things like, oh, I cannot cry anymore. Like, I just physically cannot experience the grief right now anymore. And then, okay, let's interrupt this, let's do this and that. And circling back to the very valid question, like, when are people at their limit, right? I think we should not put the pressure on us to be, to really know this. You can only try to find the right moment, but such a process will be always a negotiation with the person you are taking care of. And you might not always agree. I mean, you might propose and they say, no, I don't want this right now. I need this. And then you have to observe this. So there are no absolute rules. It's a difficult process. It needs, on the one hand, you have to listen to solution strategies someone has. If
Yes.
they really claim, oh, this is what I need right now,
Yes.
okay,
Okay.
then, and that might surprise us, right? But the receivers of care often, they have solutions, they produce solutions, and even if that wouldn't work for someone else, it works for them. So we have to be open to that on the one hand. On the other hand, also observe, is somebody hurting themselves? Are there other things like, oh my God, I feel guilty because I wasn't there when he died. I now have to suffer for that. That would be something where we might try to push more in the direction of self-care, right?
Yes.
You don't have to do this to you right now. Let's have a walk, take a breath, do other exercises, and whatever you come up with. Those are thoughts I'm having.
Yes, that is the usual talk of would have, should have, could have done when we have lost somebody suddenly or we weren't there, and this happens in our life.
Yeah.
And that is really the mental vicious circle that a person who has this event in their life is going through, and it's an infinite vicious circle of questions where the brain makes us feel and we think that we didn't do enough, we weren't enough close or helpful, or we should have done so many things to somehow make this not happen or intervene or
Yes. Guilt.
and this is fundamentally it's a guilt.
Yeah.
And but I think that if we get captured into this process as people who are going through grief, we would not be, let's say, not be able to, that's not the right way. We should actually switch at this moment our environment, our thoughts onto something else, because the question is not why we didn't do all that, but it's, and so what if we did it? Maybe we can also ask this question, and what? So what if we were there at this moment? Could we prevent that from happening?
Right.
So what would we suggest to people going through grief process about this, for preventing themselves to stay in this thought?
Yes. Yeah,
Process.
you have described it very well. This is exactly, and when you said this is a vicious cycle, that's exactly true, because that is a real trap. That is an emotional trap you can be in where there's no easy escaping by yourself. That gets stuck and that chronifies. The guilt aspect is the most frequent reason for complicated grief, which is a clinical term, right? There is the diagnosis of complicated grief, which I cannot give because I'm not a clinician. But to make people aware, if somebody wants to read up on that, complicated grief would mean, there might be an intervention adequate. Okay, so guilt. Like an example comes to mind where I was working with someone and the grandmother passed away and the receiver of care was not present, and she could have. It was not really, force majeure. It was she at that point in time very focused on herself and this and that, and the grandmother was ill for a longer period, was hospitalized for weeks. And then I get it, right? Like, it's not that the guilt wouldn't be adequate. It's an adequate emotion. So we
Yes.
cannot just talk people out of an emotion like with any other emotion. We cannot talk people out of emotions ever. So then what do you do? Because the grief couldn't be processed because the guilt and the shame were just too hard to look at, right? So you don't even get to the grief because there is the shame and the guilt before. You don't even
Yes.
get to the grief, so you don't even get to the emotional resource of the grandmother. Right? So there are two obstacles to overcome.
Well, that is very specific case, but let's say the guilt shouldn't be there because this loss happened suddenly, and the person couldn't do anything about it.
Yes. Let's talk about the complicated case that I explained before we're going to a situation where the guilt might not be adequate. Because when the guilt is really adequate, then as a provider of care, you're stuck with that.
Yeah.
What do you do? Right? Like you still have to deal with it. And the interesting thing is, what you do, you stabilize, you help. In this case, I would always suggest distancing techniques. Like, in the end, the key to resolving the guilt is to help your receiver of care empathize with the person they were at that moment. Because it wasn't that this client didn't go to see the grandmother because they were like, oh yeah, I don't want to go and I don't care. That wasn't it. And if that were the position, then there would be no guilt. So the guilt is an artifact of not actually empathize with. And in that moment of time, my capacity was limited for reasons, and I just couldn't. I couldn't see it. I could maybe not go because it was too painful to see her ill and sick. So really empathizing with that me at that time did the best he or she could. And that's still very sad that I couldn't do more, but that is what I could. How do we get to the point is stabilizing and getting this inner part, inner child work, right? That can be an adult, and getting that younger adult, usually it's an adult, to the inner safe place, and then interacting and doing inner child work. Looking at this, let's just say 20-year-old, and being like, oh my God, this one was so entangled. So many people wanted something. What did I need at the point in time? Maybe support in certain areas so that I could actually have done what was important to me, which is visit my grandmother when she was dying.
Yes.
And once the empathy is there and the care for the inner child work, the guilt disappears.
Wow.
It just goes away. It's poof. Because guilt is always a lack of empathy with our own limitations at a certain point in time. So the guilt disappears almost instantly. And then comes the sadness. And it's gonna hit the person like a freight train, because that then comes very suddenly. It's like you really, okay, guilt, done, next thing. And then you suddenly have a person who is mourning. Suddenly. They weren't mourning 1 minute ago, and now they are. And then you accompany them through that, prevent it's getting too much, stabilize, put pauses in the process, inform them about what happened. Like, okay, you're grieving now, this is gonna take a while. Because they were totally not aware of this. And then slowly in the grieving process, the resource of the grandmother can be activated. And this is beautiful. It's a beautiful process, intense, but this is exactly how to do it. It's inner child work to get rid of the grief. This empathy mechanism takes care of it. And the other example, when you said, well, but it's not really appropriate to have the guilt. These are people who are expecting too much of themselves, you know? Like, oh, I should have been there. I should have been able to fix. And realistically, we're like, could you really have? And there I would propose the same process. Again, stabilize, take these inner parts to the safe place, let them look at it. Maybe distancing techniques here. To say, hey, distancing in the sense of flying, seeing you from a distance, and assessing, could you really have, was it really your role to do this? And usually that brings the necessary clarity to then get to start the grief. Some interesting, really practical solutions there, no?
Yes.
Don't you think?
Seems almost like magic.
Yeah.
I mean, the effect and the impact, sometimes it's really immediate. This is the fascinating about the work.
Certain things happen rather quickly, and then other things take a very long time. That sometimes confuses people in my messaging, because I sometimes say certain things are very straightforward, and if done right, they're like, like a switch is flipped. But that doesn't mean all the work is done. There then is still longer periods of months and years to actually integrate, and after these moments of change. This is why I never use the word breakthrough. I don't like it.
What about transformation? That's a new word that I was kind of fascinated lately with. Can that be, can processing of grief, maybe once we have gone through the, let's call it protest or not accepting that this has happened, then we're falling in the trap of maybe despair for a while also. And after certain steps, amount of time, can a grief be transmuted into something else? We cannot break through, really. We can make it into something else.
You used just the word despair. That's interesting. Are you referring to a moment where someone feels, oh, this is never ending, and there is a certain element of hopelessness, or
Yeah,
what are you
hopelessness,
referring?
unable to deal with it also. And this, or let's imagine, okay, he's not gonna ever come back. I'm going to enter this house where I was, where I would expect to meet again this person, feel this person, or even smell the aroma of this person that I have lost. And I think apart from the protesting, there is also the desperation in the process of grieving. And at some point, transmutation of the grief into.
I think the point I like to make here is when it comes to how much memories someone can bear at a moment, right? Like being reminded all the time. Like if the life partner dies and the person still lives in the same flat or house, and then people say he or she is everywhere, right?
Yeah.
Because you see him in everything, right? You've shared this, right? So there is the question of how much of the memories can somebody bear, and that circles back to how intense can the process be in order for the person to still be able to
Do it.
survive this, literally. Like it cannot be too much.
Mm.
So here I would say that maybe interventions of, if necessary, to have a certain distance is certainly something that could be proposed. Like when family members then would say, hey, stay with us for a while, you know, that could be something. Someone could say and reject that and say, no, I don't want this. I want to be there where, you know, we were. And okay. But that could be an idea, for example, when things are too much. What some people do, I mean, a lot of people, when a child died, you know, like people are in this conflict of, oh my God, the room, the pictures. If we put them away, is it like we're unfaithful to our kid? But it's also too much, right? And
Yes.
I think people here may give themselves the permission, and they may get permission from, or encouragement is not the right word, but we can tell them that it is totally fine for a moment to have a bit more distance,
Yes.
to make it through it, and then come back to it. You know, then put the pictures back up when you can handle it, when the moment is there. And the other people certainly can help, sure, especially if they behave in the way of being as patient as possible, that they know that this comes in waves, may come surprisingly, and also they're not supposed to do anything really, and that's so difficult for people, you know, to
Just be there.
bear the silence and be there.
Yeah.
And it's really easier said than done. I mean, even for the professionals like us, it's always, again, we have to remind ourselves it's not the moment to propose anything other than maybe these impulses to prevent someone getting overwhelmed and for too long, and maybe other organizational strategies of the things we discussed. Yeah. Mm-hmm.
Yes.
Mm-hmm.
Maybe we can circle back to the transmutation of the grief.
Yeah, you asked if the word transformation is a term, right? I would use. Was that your question?
Yes. Is that possible to be done, or that how it happens? Because you mentioned various times that grief can take decades or the process of grieving, mourning can really take a long time. But at the end, isn't it that it's becoming into something else?
Grief never ends. Like if it was meaningful, it just never ends. But it changes its shape, and its form, its intensity, and its content. Usually, the parts of the grief which are just pain, just the time spacing becomes longer. But if someone enters into that, they can still access the same pain. But what weaves in is more access to what the person, in our example, gave us, that we're grateful, all the lovely, good things. We also remember the bad things sometimes, right? I mean, nobody is just light. We all have a shadow side to some degree, and it becomes normal to accept all these things. And here we are assuming, so far in our examples, we have been assuming loss of someone who has had a mostly constructive influence in our life. No? But there are also relationships which have been much more complicated. And
Yes.
these people also pass away at some point, and that loss might be naturally complicated because there is the loss to process, but then there is also, yeah, but I also was quite hurt by the person,
Yeah.
right? So
So
these two things go then together.
mm,
And here, in my opinion, literally two types of work have to happen in parallel at the same time, depending on what needs attention.
uh-huh,
Is a person right now sad about the loss? Then it's grief work.
uh-huh,
Is it more, but I'm angry about things that were done to me?
uh-huh,
Then it's working through that, right?
mhm.
And providers of care should be knowing that there is two things going on, and you react to what comes, and that you work on, basically.
Yeah, you don't try to navigate it, don't control it in a certain.
No, it happens as it happens. I mean,
Yeah.
at least in the way I advocate it is, you deal with the emotions that come.
Mhm.
You can't really influence that anyway, right? If somebody comes in angry, they're angry. Like there's nothing you can do
Mhm.
about it other than apply the appropriate techniques. If they come sad, yeah, you apply the appropriate techniques, and so on.
You mentioned we mentioned different kind of losses: a deceased close or beloved person, a person that was not so much close to us, or we had contradictive emotions about our connections with them, but still we have grieving and anger, for example. We mentioned also a loss of a child, which is maybe one of the worst case scenarios. But what about if we can call them, other cases where are they lighter in a way? Loss of a pet, loss of a job, loss of a friendship connection.
I mean, pets are often family members, so that can be surprisingly tough. And when I say surprisingly, it shouldn't be surprising, but so that would be totally normal. Like that is like a person. I mean, especially if the pet, you had the pet for many years, they're
Uh-huh.
part of the family, right? So there is
Yeah.
a grief process related to this. And who are we to judge, like to say how deep or how long or how intense something is supposed to feel for someone? That is really it. That is not at all really a focus, I would say, of grief work to consider, oh, is the intensity of grief adequate?
Okay.
Not really. If someone experiences this very, very intensely, there will be reasons for it.
Yes.
Maybe that pet really was the only best friend someone had, right?
Oh, yeah.
It's very different maybe from some kid having a guinea pig for a year. And
Yes.
they'll be sad too, but it's maybe not the same as somebody had a dog for 12 years and went with the dog through thick and thin and whatever. There's much more of a thing. So often the intensity of grief correlates with certain aspects that do make sense. Sometimes it doesn't. This is something I learned in this work over the years, that sometimes events that seem small, and I'm talking now generally, I'm not just talking about grief, things that seem to us like, was that such a big deal? But they can be very fundamental for someone in a specific moment. And there are then good reasons for that.
Yeah.
It just had a high significance because of factors that we might not fully know and understand yet. So it's really not about judging it. I mean, we can internally take note and be like, the emotion seems to be, the intensity of the emotion seems to be rather disconnected from what we know about the event.
Yes.
But okay, accept that and move on and do emotional work.
Yes.
Sometimes we don't know the whole story. Sometimes the person doesn't remember the whole story also.
Yeah.
Right?
You mentioned kids having lost their guinea pig. How do you... Not everybody would find it easy to explain to a kid about a loss which they have never experienced in their life when we're talking about small kids. And kids usually have very vivid imagination, but at the same time, if you want to explain to them something, it should be really practical and not any abstract words used.
Yeah. Like, maybe the first thing is that children can deal with reality often much better than we assume as adults, because we have so many barriers of actually sometimes speaking things out the way they are, right? And kids can actually handle it so much better than we think.
Yeah.
Still, there is certainly thoughts about making it age appropriate in a way. I would advocate, when it comes to the choice of words, to use a word that that encapsulates what is actually happening. Yeah, grandma died.
Yeah.
Yeah, it's very different from grandma went on a long trip.
Yeah.
I mean, and depending on the religious context in a family, one might say grandma went to heaven. Okay, so then you have reasons to say that, and you would then usually also convey to the kid a big, like, what is heaven then? Oh, heaven is the place where people go when they die, when they're not with us anymore, and that's a beautiful place and this and that. If that is the framework you want to advocate in your family, then that is this. If I look at it from a non-religious perspective for a moment, clarity and children can, they don't break down just because we explain to them what happened. Of course, you would remove any gruesome details from it, but the word grandma died is totally appropriate. And that avoids issues downstream when someone becomes older, because first of all, you were honest with the kid. This is what it is, and they learn a framework of understanding how the world works, and they have a word for that. The word death then has a meaning.
Yes. Yes.
Right, and we owe that to children, that they can learn also that aspect of life. Is that a nice moment to do? Certainly not. It's not a nice moment for anyone. And the example in our preparation call, the example I thought of was where a pet died in a family, and the 3 or 4 year old boy of the family, and the parents were asking me, how should we communicate that then? And they then decided to say that in exactly the way, and also making a ritual like burying. In this case, it was a cat, a cat for like 10 years. Um, so they were, I mean, the father of the family did the burying, but when it was like done nicely and there were some flowers on it, when that was kind of done, the boy was shown and look, and this is what we do, and of course they all cried, and that is not damaging a kid to see the parents sad. It's an opportunity to see, that is death.
Yes.
They are very sad, and that
Yes.
is the appropriate emotion and the appropriate manifestation of it. So, and then some family member died, like a person, a human.
Yes.
And then the 2 or 3 years older boy
Yeah.
could say, this is like what happened with the cat's name.
Yes.
There was already a framework. So the grief, the sadness was, and the boy could cry. And so there was established an understanding. And even though he was like, I think 3 years old at the moment when the cat dies, then when that was being told to him about a family member, he still had the framework.
Yes.
So this is why I really say clarity is there important, using the words. There are maybe more considerations to make there. I would claim that what I just said there was now a complete handbook on how to handle grief with children. I don't claim this. But from the basic idea, this is kind of the direction.
We shouldn't deprive them from observing the emotions that we're also going, of course, always
Yes.
healthy.
Exactly. Yes. Like, this is the reason, this is how I feel. So they can connect that. Because otherwise they're going to instinctively ask themselves, what do these emotions now mean? What is it? Is it me? Right? Like, it's then a mystery, and that doesn't help.
Yep.
You did mention in the very beginning the concept of the stages of grief. I would like to say something about it, but very, very briefly. Like, I'm not no expert on that. It's not a concept I use a lot. And I think the Kübler-Ross 5 stages of grief, they have been, I heard they are having been debunked, saying that, it's not the same for everyone and the sequence can be different and all this and that. Be that as it may, I think the stages of grief idea can still teach us that there are very different experiences that can happen related to grief. And I think that's still valuable. That people can be angry, people can be sad, people can be something else, people can deny, denial and whatnot,
Yes.
these stages. It's not necessary to make this a static fixed rule. And I also doubt that Kübler-Ross was really meaning that. Because that was an empirical investigation and seeing that, there are patterns. There's a typical sequence that of emotions that people go through. It might be still different. Typical
Yes.
doesn't mean everybody, but there's still something valuable in there to see, okay, it's not just you're sad and you grieve and that's it. No, there are other emotions that can come. That's what I think about the stages of grief and what their value is. If somebody wants to read up on that, they should do so. I mean, there was this maybe very basic question, but when should someone seek out help in their grief? When they feel it is getting either overwhelming and too often, they feel it is like even after many months still massively impacting their life to a degree that it is debilitating. And here it's so difficult to find like a rule, like what is too much. I couldn't tell, but at least it is definitely adequate to at least see someone to evaluate is some intervention and accompaniment here adequate or not, right? Because it really depends on the example. It's very difficult to come up with general rules for that, but
What about if with the time it gets worse and not better? Isn't that kind of a rule that can be used, applied?
a good point. But what about you haven't been grieving and now you start, like that would be, from the outside, it would look like you got worse, but actually you just started. You didn't really grieve before or mourn. And people are like, oh, she's handling this well, and then out of it, like 6 months later comes the deep hole. And then people are like, oh, what happened? That doesn't mean that would be necessarily a sign of that. Maybe the counterpoint I'd like to make: does grief always and usually require accompaniment from someone professional? Definitely no. Like, that's not it's not your default to seek professional help. Definitely not. That should be reserved for situations where things cross a certain line. It can be advisable to have someone around, a grief counselor, in the early phase, and usually institutions like hospitals ideally do provide that, to shape the grief in a way that it takes on a good path. I mean, as much we can call that a good path, but that a constructive path forward, to prevent things happening. For example, if somebody directly in the very first moments already says, oh my God, it's my fault, or something like that, so you can catch the guilt early and maybe handle it before it chronifies.
Yes.
Right? Before it digs in, you can maybe catch it early. So that could be another best practice. But to say that every grief requires long-term counseling, I would totally not agree. And I mean, we're no counselors, I'm no clinician, so I cannot give any advice on what kind of clinical interventions people need or don't need. So take that all with a grain of salt. If you feel you have a mental health relevant condition, please seek professional advice. There's the usual disclaimer. But I think it can give some orientation. Grief is normal. It is normal. It's painful. It's normal. It takes long. But then there are certain signs where you can, maybe this is something for people to look up in a reputable medical source. What are criteria? What are red flags to look for? That would be more competent and reliable and adequate to look at that, because we're not the ones making these decisions for people, right?
Yes.
As non-clinicians. Somebody comes to us. I mean, what we do is, if there are red flags, then we would also, refer to a clinician, right? If there are other things that look like, oh, this seems to show signs of a serious mental health condition, then we would refer. Yeah. Very nice speaking to you. That was exciting, and I think we covered a lot of things.
Yeah, we did.
Depending on where we upload this, people could feel free to put questions under the video, right? And we might be able to answer them, or you on your channels, I on mine, and that could be very nice. I'm looking forward to the next time we speak.
Me too.
About emotional work. Thank you so much. Everyone, have a great day.
Thank you too. Have a great day. Bye.